Alright guys, we are doing Kybella, and Kybella is deoxycholic acid, which is a bile acid. And basically what this does is remove the fat. And usually you would need around, well, depending on the area, you can do maybe like 3 to 6 treatments, but no more than 6.
A month apart.
And 1 month apart. And usually most of your swelling will be the first week. Usually results are within 4 to 6 weeks. So having said all of that, let's mark Doctor up and get it going.
All right. So we're focusing today. We're going to be doing.
So we're gonna do some lower abs, and we're gonna be doing the lower abs. We're gonna do some flanks, and see if we can get that 6-pack body going before summer starts.
Okay. So then first we're going to be doing Kybella, which I actually think is interesting because if you put this in the neck, it doesn't work as well because the fat is deeper and doesn't really melt it. But in the sub-Q fat, it tends to work well.
Almost done. Couple more.
You're already skinnier.
Good.
All right. Now we're going to do CoolSculpting. We're going to jump on that. Okay. Let's do it. What's the best time you think to do CoolSculpting? Is it what month of the year?
I think the cooler months so we can get summer ready.
So like this is the month, right?
This
March.
is the month. This is the time
February,
to do it
March.
if we're gonna do it.
Boom.
It should take about 4 weeks to see a difference, right? You think 8?
Yeah, so at the beginning of 4 weeks you should start to see a little something.
CoolSculpting, I think the interesting thing is when it does its first suck of your fat.
Mm-hmm. Yeah, the first like couple minutes when you're doing CoolSculpting, that's when it feels the most intense.
You start to feel the cold. That's
Start
like
to
your
feel the
point.
cold, yeah.
So this is the CoolSculpting Elite. So this is the latest, greatest CoolSculpting device.
Yeah, so this has the ability to do 2 applicators, but for you, we're just gonna do 1.
So restrictions, basically there's none after this, right?
Nope. You can go about your normal activities throughout the rest of the day. You can work out after if you'd like.
And if someone had like a wedding or something, when would you advise them to do this?
I would advise them to do this at least 8 weeks prior to like a major event to really see those results. Okay, so
This is going to change your size, right?
yes.
Here we go. It's about to suck onto the fat. And 1, 2, whoa. There we go.
Alright, we can start strapping again.
And it goes cold immediately. It actually doesn't hurt at all. Give it a couple minutes.
It gets a little spicy, but I wouldn't say that it's painful. It's just
What
like
temperature do you think
a
it's
little
at right now?
spicy. I think it's -11.
Celsius?
Yep.
So what is that in Fahrenheit? Hey Siri, what's -11 Celsius in Fahrenheit?
The answer is 12.2 degrees Fahrenheit.
That's not terrible. Kybella or CoolSculpting? What do you think?
They both are really good, but I'm gonna go with.
We think they're both the same.
Honestly, they're both really good, but I think Kybella will give you the results a little faster than.
I think CoolSculpting focuses more on the contour of the body versus like Kybella is like just like a hard
Destroys all the
hitter,
fat cells.
hard hitter for the fat cells.
Yeah, my answer would be probably, I think they're both important, but
agree.
you don't have to do Kybella, but it's nice to do, and it kind of like sort of like kind of work in combination. And you can work in different areas because CoolSculpting seems like it's going to be in just that area, like it's right below the skin, that 25%. Versus Kybella, you can kind of treat it in kind of different areas that might be difficult to reach with that.
Yeah, and that's the thing with CoolSculpting, certain areas where like people would say they have fat, you would try to pinch it, and you're like, there's nothing there. I personally heard that, like you telling me, Renee, you don't have anything, and I'm like, but it like hurts me because I have like a little overlap, right?
Yeah.
You can't get that with CoolSculpting,
Right.
whereas with Kybella, you have that option of getting rid of it. So.
People always ask if it's permanent. So I know with liposuction, you'll see people who do it and say, my fat came back. How many of the CoolSculpting patients do you see coming back saying, it worked, didn't work, all that kind of stuff?
I don't I honestly don't see that very often. Usually when they come back, they're just coming in for another round because they just want to enhance those results, or they're coming in for different areas of their body.
When I do CoolSculpting, like when I first did it, I had to kind of cinch it down. Now the goal is to cinch it just a little bit more because again,
You can see those little contours. And,
Yeah.
um,
See, and that's what's nice. You put kind of, even when you're doing both treatments, you can kind of contour that.
Mhm.
And then, that's nice.
and we care what we look with the shirt on, but to me it's actually more important to what you look with the shirt, shirt off, but what you look with the shirt on.
Right.
Because when you're walking around, people see you, like how a suit fits you,
Mm-hmm.
and it looks a little sloppy on I think on guys sometimes when it goes out and you see a little bit of.
I honestly, can I be honest? Yes. I feel like I'm having coffee talk with Dr. Shah. I personally cannot, that's a thing for me, pet peeve, is when I see the love handle. And I did CoolSculpting for it after I had my baby. I started seeing it in my shirts, in my gym pants, it would hurt
Very
me.
obvious.
So I did one treatment of CoolSculpting and it went away completely.
Well, I think what you see in guys, it's actually much more pronounced in women because dresses show everything, right? So for men, things can be sort of hidden, but it's unfair. So that was, what, 30 minutes?
35 minutes.
Actually, I fell asleep.
You look rejuvenated.
Yeah, that's from a nap. But it's actually not that bad.
We did about
Okay.
35 minutes, we have about a minute left. Once the timer goes off, I'm gonna turn off the suction to the CoolSculpting applicator. We're gonna unstrap him, and then we're gonna remove everything and then start with a massage. About 50
And
seconds.
in massage, it literally just pops.
the fat bubbles that are.
Yeah, it's kind of it's encouraging it to push it through the lymphatic system, so we want to make sure that we give like a nice massage. That's the most important part about the entire treatment. So we want to make sure that we take our time doing it.
Here we go.
Ab reveal.
Oh no.
So when
It
you're
looks like
removing the applicator, you want to make sure that you don't just pull the applicator off. You want to get your finger underneath to release the suction. And then you want to gently peel it back.
Like a little alien baby.
So it's a little red, but that's normal.
And this is something you could not do on your own at home. It won't work.
No, I would not. We're going to do a manual massage. We're going to do it. It's okay.
It's not that bad.
Okay.
It's all kind of cold and nummy.
Exactly. So that's why you want to do it like pretty quickly while it's still numb. You want to do it in more of a downward motion. Let me know how it feels. Okay.
Actually, I think I did pretty good because normally my hands and feet get really, really cold. I'm not sure. But for this, it's actually not terrible.
I've heard the lower abdomen doesn't hurt as bad as other areas for the massage.
What's the most painful?
I want to say my patients say that the sides are pretty bad.
So what's the massage for?
The massage is to help break down those fat cells that we just froze, and it's like encouraging to push those through the lymphatic system. So you can kind of feel too when you're doing a massage, like you can feel the difference in the tissue and the areas that you need to work on a little bit more.
Yeah, fun procedure, but I think it's, and you can work out tonight.
Yep.
The color's starting to go back to normal.
Normal activities, no downtime. Might have a little bit of redness, a little bit of soreness, but all normal.
Not bad. Thank you so much, Krista.